Okay. Good evening, everybody. I'm welcoming all the audience and participants for today's session. We are doing that today, 5 p.m. We are having once again. We are having one speaker that very much familiar with us. That is our Dr. Shuman Sharkar. Actually, he was familiar because he was the faculty of Shalatantra department in Belle Sankarpur Rajiv Gandhi Arbuda Medical College and Hospital. But recently, he is a medical officer with the special in charge in Shara Sutra department at Shamadash Vaidya Shastrapit and Institute of Ayurvedic Education and Research in Kolkata. So today his concept of Ayurveda, way of understanding. So warm-heartedly, I'm to start his presentation towards our audience.
Good evening, everybody. Today, first of all, I thank Dr. Priyanka and his teammates for giving me a chance for this presentation. Today, I will telling about the Arbuda cancer. That is our concept of Ayurveda in according to the Arbuda. Okay. Priyanka, you can go to the presentation slide.
Yes, sir. I'm just going to show the presentation. Yes.
Today we are discussing about the Arbuda. That is Ayurvedic way, how we can learn, how can we understand Arbuda in our methodology. So, second slide. So, Arbuda it consists of two words. That is, one is Arba and one other is Uditi. Arba means the word Arba denotes that to kill, and Uditi means to elevate it or to rise. Arbuda is a numerical word which means 100 millions, which is due to the uncontrolled proliferation of the cells. So why this proliferation? The proliferation is due to the loss of response to the normal growth cells. Why there is loss of response to the normal growth? Due to the damage to the genes, mainly to the oncogenes. The oncogenes, because it is due to the exposure to the carcinogen. Okay, next slide. Let's comes with the sign and symptom of the Arbuda. We know that the slok is very much familiar with us. That is Gatlo Kodeshe Koshchik Dosha Sangmurchitang Mangsham Abhiporusho Vittam Srirang Mandarujang Mahantam Analpo Mulam Ananpo Mulam the Podesha Koshchik Dosha Sangmurchitang Mangsham Abhiporusho means they are the pathogenesis of the diseases. And last 3 lines I use the sign and symptom of the doshas. So when there is vitiation of the dosha, next slide. When there is visible. Okay, visible.
Okay, sir.
Okay. When there is next slide. When there is vitiation of the dosha, when there is vitiation of the dosha, it can go anywhere in the body parts, while it damages the muscular connective tissue along with the connective endothelial cells and causing the Arbuda. So what is the sign and symptom? That is Vittan serum. That is the growth is round and stony hard. And Mondarujam is the pain is not present, except the pain can be seen in the final stage of our disease, Arbuda or cancer. Next is Mohantam Ananpo Mulam. It spreads with the deep root, means the cancer is fixed with the deeper structures. And Chiroviddhi means it is chronic in nature and gradually in progress. Opakam means it is non-suppurative. And Mangshong Upochai is the unnecessary and uncontrolled abnormal proliferation of the tissue. So, what is the Arbuda? Next slide. So, what is or it is a deep but palpable tumor which is fixed to the underlying structure. Look, next come to our etiology or Nidan. It is very much familiar with the Shofo and Granthi. Shofo is the universal swelling. Where is the Granthi? It varies from the size according to the Bhagavata. So both Shofo and Granthi both the cause of as similar cause of the Arbuda. They are the precursor or predominant syndrome of the Arbuda. Hari Sangita mentioned as a special etiology, that is, if there is any trauma or obligata, it causes damage to the cells, which gone by the Roctronine and producing Shango elsewhere in the body. So and containing and forming a Arbuda in elsewhere of the body. So coming to the step of the pathogenesis. According to pathogenesis, we can classify the Arbuda in 3 stages. That is Shof, Granthi and Arbuda. In first stage, we can see the Shofo, that is the universal swelling. Thereafter, Granthi means there is some elongated or nodular structure can be seen. After that, Arbuda comes. First, 3 or 4 is the Shadra, that is Batoja, Pictoja, Kophoja and Medoja, that is benign state. And Roctoja and Medoja, Roctoja and Mangshoja is the Ashadra state. And when it is metastasis, we can call it Ardha Arbud or Pre-Arbud. Ardha Arbud is nothing but when it is goes over the pre-existing one. And D-Arbuda is the when goes simultaneously one after the another. So come to the Kriyakala, next slide. So in a word, we can definition the Kriyakala as a Sanchay, Prokop, Kosher, Sanchay, Depth and Grade. Sanchay is the localization of the dose. Prokop is the acceleration. Kosher is the speed. Sanchay is the embolization. And Bacti is the reaction and Bed is the chronicity. Slide not coming, no? Again, slide is not coming.
Yes, sir. Yes, sir. One second, sir. Sir, is it visible now?
No, okay, the next slide.
Yes.
So we come to the Samprapti Ghatakatta. So what is the dosha? The main dosha is the kapha and vata, and it may be associated with the Tri-dosha. The dusha is the mangsha, meda, rakta. Choto is chotorushti, mainly the shanga, and sometimes it is causing the shiragranthi. In here, always there is the mandarini there, and rogamarga is the bajya rogamarga. It can be situated anywhere in the body, and in the skin it is situated in the rohini layer. And the main symptom is Mangsham Pochedam to Shopam, means there is the elongation of the connective tissue with the epithelial tissue. Next slide. So next come to the classification of the Arbuda. We can divide in 2 parts. According to dosha, it is mainly 6 types: Vata, Pitta, Kapha, Rakta, Mangsha and Meda, according to Susulka. But if we divide it in 2 parts according to dosha and dusha, we can see Vata, Pitta, Kapha. Didosha and Sandipata is mentioned in the Bhagavata. Whereas Rakta, Mangsha and Meda has been mentioned by Susuta, and Oshti Arbud is mentioned in the Bhagavata. Okay, come next slide. So let's come to the sign and symptom of the Vishishta Lakhan. So why this pathogen? Because there is stretching of the tissue due to the carcinogenic cell. So there pain in Batoja case, there will be stretching type of pain, pricking type of pain, and throbbing. cutting type of pain, and it will be black in nature, and it is characterized by bladder distended with air, with rough and elongated. In pitta, there will be associated when they are stretching, there will be associated with the inflammation. So there will be the burning, in burning sensation, boiling sensation, suckling sensation is like that. So the color obviously will be the red and yellow, but there will be no separation. Again, not coming. In metager, there will be slight and painful with excessive itching, and there will be, it will be bigger inside, and it will be decreasing the swelling according to the size of the body. Let's come with the benign treatment of the benign disc condition. In Bataja, we are giving the Uponaho, then then Nourisher, and then Singo to immobilize our cell consistency, so the pain will be less. In Pittaja condition, we are giving mild Shedan, Uponaho, Birechon, Lepon, and Raktamakhan. In Kafaja condition, we are giving Snehan, Shedan, Bamon, Birechon, Lepon, Raktamakhan, Maggot therapy, Agnikarma, Kharkama, etc. Because in Kafaja, the tissue is densely in the capsule, which is confined, along with there with the itching sensation. So we have to neutralize this dense tissue. So Kharkarma, Agnikarma all should be done. In Metajam, we are giving Shedan, Bidaran, Shodon, and Sivan. That is mainly we have to cut the lipofat tissue, and then we have to remove it with the elongated with the capsule. Thereafter, we have to suture it. Okay, next slide. So the Oshadda, that is the carcinogenic state, we can classify it in Mangshaja and Raktaja. Mangshaja is Ovigat, it is due to the Ovigat. There is the swelling affected the Mangsha, characterized by the painless, glossy, non-suppurative, stony hard, immobile, with normal color. And in Raktaja, there will be the decision of the dosa, which is caused by the Rudila Shira, and but there will be no separation, and there will be muscular lump, and the main thing is there will be touch in bleeding. That is Mangshanku. That stress angiogenesis will be occur. That's why there will, when we touch it, there will be a severe bleeding. Okay, next slide. So other Arbuda, what is the other Arbuda? We have known the Nasha Arbuda, there is Jiva Arbuda is there, Posha Arbuda also there. In fact, that is the throat cancer. On that, the Rocta Arbuda is the Ashakta. Jala Arbuda can be started as a mucosal cyst, is Shakta. RR is Gala Arbuda, Dala Arbuda, Karna Arbuda also is there. So in a word, next slide. We can classify the manifestation of disease in, that is due to etiology. There is dose dusha sammuchana, which is causing the cancerous or metastatic stage. Okay, next slide. So how we can classify it? We can classify it in our understanding. We can GI malignancy. We can classify it in Gulma, Asha, or Bidjari. In the GI gastrointestinal tract, the main inner lining, there will be Bidjari causing the cancer. Whereas when the woman is bulging out, that is from the inner side, it will be the Gulma. When it is out, when it is inner side, there will be the Asha, and when the lumen of the GI tract is bulging outside, that is the Gulma. Gulma, it may be palpable or not. When it is palpable, it is known as axial gulma. When it is not palpable, it is known as apponter gulma. Next slide. In respiratory tract, we can can be correlated with the Khatojor Khoyal Kasham, Rajakha, the treatment which is mentioned on there, we can give it on the respiratory tract malignancy. Next slide. In the hepatic malignancy, we can see the Pandu spectrum of disease. There is lot of disease related to the on that variety. We can see the CRP, ESR all be high in account. With this, there will be the less in hemoglobin. We have to treat an infection first. For that, we have to give some our medicine which is related to the Jocrit and Pliha. It will affect with very much. Next slide. So our aim of the treatment is mainly the Samprapti Vighatan. So the main pathogenesis of the disease we have to we have to, when it is shorter stage we have to treat the shorter. When it is the Arbuda or benign stage we have to do acute treatment. If it is benign, it is better for the surgery that is previously mentioned. Means after Lekhan and patient we have to go for the Shivana Karma. And when it is the Ashadda, that is Raktaja Mangshaja, we go for the Vadi Vipritam Koshuram. And if it is chronic stage, we better go for the palliative care. That is the Roshan therapy and else. Okay, next slide. So in the we can see what is the basis of Chikisha. We can again subdivide in two parts. One is Bajya. That is there is 6 or 7 Bajya. There is a lot of Bajya treatment. Some of them is given in here. That is the Shedanam. So when we go for the Shedanam treatment, when it is the Ruja done, means when it is indurated, when it is painful, we go, and when it is the hard, we go for Shedana because it loses the tissue. It helps to come out. Then then we go for the Lepana. So when we go for the Lepana, in which condition? Means early stage of the inflammation. That is mentioned as a shock of Uchita mark tissue. Means when just inflammation started. And just first beginning of the disease, we go for the Lepana. And when we go for the Upanaha, we go for the arm and without the step. Means not arm and supporting condition. In between, we then go for the arm and without the step. And when we go for the Bimla Panchikisha, that is Shiranam Ujatang Mondo, means when it is fixed to the deeper structure and it is painful, we can go for the Bimlapan. The Bimlapan is nothing but a gently massage by the finger. Means it loses the tissue. And Pachan, we have to go for the Pachana when for induction of the suppression, means we have to make it the below the stage to pass come out. Pachana, generally all this Bajya treatment is indicated in the benign conditions. And abundant Chikisha, when Baman is that is a Sharan and Shaman Chikisha. When Sharan Chikisha is go for Baman, first Sharan is Baman, Virechan and Raktamaka. Baman is done when it is the Pushana Mangsha Shokam. Baman is done when there is ulcerative lesion, when ulcerative granulation tissue is being shown. Means granulation tissue is poured out outside. We can go for the Mangsha. This toxin will be liberated out. When we can go for the Virechana, in Virechana is generally done in chronic stage. Means when it is very much old in nature, chronic in nature, we can go for the Virechana. And generally the Raktamakana is go when there is excessive pain to reduce the pain, and when the toxin is accumulated much in the cellular tissue, we can go for the Raktamakana. Jaloka or any is always very preferable in this condition. And Shamana we are go for the Agnidipana, Ampachana, Shotashodan, Roshan, and Patho. Patho is another is very informative in nature because we during the cancer stage we have always maintained the Patho. should be loku in ahar. Next slide. So other treatment is the Shalla Karma. That is Shalla Karma is generally done in benign condition. That is after that is Meraje Granthi or Meraje Urbud like that. We have to go for the Shedan, Lekhan and Shivan Karma. That is the Shastra Karma. And after that we have to, if their pain is much more there or kafar would there, we can go for the Agni Karma, Khar Karma and Jalu Karma. And other treatment is followed as when the disease is in which condition. If it is look like Shopa, we can go for the Shopa treatment. If it is look like the Granthi, we can go for the Granthi treatment. If it is looks like the Bidrari or ulcerative, we can go for the Bidrari bot treatment. So let's come to the medicinal part. Which type of medicine we can generally prefer? This part is much more important in our perspective. We have to, which medicine we will go in which condition, it is much more important. Generally, all the Rasha Ushud is given in inflammatory conditions. It generally inhibit the signaling of the vasoendothelial growth factor and also decrease the angiogenesis. It also reduces the inflammation. Generally, the Rasha Porpoti or Rasha Sindhu or is generally this type of medicine is generally given in the liver or spleen carcinoma. In Rasha Porpoti, we know the doses. We generally avoid the salt and excessive water diet. We will go for the Dodhi Takro diet on this on that condition. Because it is mainly in cirrhosis condition here, ascites or cirrhosis, we are giving the Rasha Parvati. Tamravasya or Tamra Parvati or Tamra Sindur, all are given in mainly the gallbladder carcinoma. Also in Shamnatrama, it can be given in any other also in various conditions also. Generally, when the cancer is associated with the lot of hiccup, it is generally seen because there is irritation in the phrenic nerve due to the irritation in the diaphragm. We see the hiccup. On that, we have to go for that Tamravasya with the lemon juice. When there is a GI manifestation, when the cancer is with the GI manifestation, we can go for the shoot and madhu. When spleen is involved, we can go with the punarnava. When gallbladder is involved, we generally go for the Potal Muladi Kashai. When it is associated with the prostate or abdominal tumor, we can go with the Kumaria Asham. In Kama Corpoti also in the case, you can also use in the previous slide. Tamra Corpoti is generally used in the skin condition. That is the leukoderma. All these conditions we can use. And Vijay Parpati is generally used in Vata Pitta condition. Generally it is used in the liver disease, gallbladder disease, and severe colic pain. It also very helpful when it is much more ascites is there. We can use it in the Bardhaman Matta also. The most common phenomenal name is in our English Hirakvasya. Hirakvasya is associated with the Sharnavasya or Ropavasya. It is generally used in various type of carcinoma. If there is much more inflammation, we can use it with the Ropavasya also. Rasha Gandhi, Rasha Sindhu previously said that it generally is in the breast carcinoma, or it can be also used in the skin conditions. Generally, where the CRP is much more high, we are generally use the Rasha Sindhu. Rasha Gandhi Mechu Park is another is a Shishidda medicine. It is Parad, Gandhak, Rashakorpur, Harita, Kantalogo, Tuthak, Rosamanikko, all are used in the Rosagonni Michupa. It is generally given in 180 mg 180 mg twice a day. Generally, when this medicine will going on, the person should not be bathed. After 7 or 8 days, he can stop the medicine and take a bath. Again, then it will be continue for 41 days. This is a type of our chemotherapy like Uprofarma. It can be increased in it can be in Bardhaman Matra according to the condition of the patient. And another is Chandam Arutam Shindaram. Arithrosum is also used in various type of carcinoma. There is another orchestra Ross is there, which is used in the pancreatic CA. And Gulmo Kutha Ross also is in the uterine carcinoma. There is also Bangavasho and Nagvasho is also used in the BPH. When there will be pain with BPH in the prostatic carcinoma, Nagvasho is added with the Bangavasho. Okay, next slide. So previously all we discussing about the Rasha Ushi. Now we come to the herbal preparation. The much more familiar with us is the Bhalatak Rasayana. Generally, this Bhalatak Rasayana we are giving in Bardhaman Matra. We know the Bhalatak is 10 types we can use. That is Bhalatak Toilo can be used, Bhalatak Dugdho can be used, Bhalatak Grito can be used. In my practice, I generally prefer Bhalatak Thiropak. Means I generally prefer we giving the Bhalatak Rasayana as a Bardhaman Matra. First, we have to go for the Bhalatak Shadana. After Bhalatak Shadana, boil with Dugdha in Bardhaman Matra up to 10 days. We give it in Bardhaman Matra. Thereafter, 10 to 21 days, we are giving in the same ceremonies. Means first day we are giving 1 Bhalatak, second day we are giving 2 Bhalatak, 10 day we are giving 10 Bhalatak. From 10 to 21 days, we are giving 10 Bhalatak each day. After 20 days, we are decreasing the dose. Means 21 days there will be 9 Bhalatak, 22 days there will be 8 Bhalatak, 23 days there will be 7 Bhalatak. Like this, it will be going on. And when the Bhalatak Rasayana we are giving first, after giving 1 month treatment, we rest for 1 month. Again, second month, we are giving the Bhalatak Rasayana. After that, we rest for 2 months. Thereafter, after 3 months, we are giving same Bhalatak Rasayana. In this way, we get a lot of good results in rectal carcinoma, in throat carcinoma. Generally, much more patient is long livelihood. More than 4 to 5 years, it is generally going on with this type of Rasayana. After 6 months, we continue 1 Bhalatak Rasayana of this type of patients. Shilajit Rasayana we are preparing mainly in the BHP patients, benign prostatic hypertrophy patient and prostatic carcinoma. In prostatic carcinoma, we can give it Gugul Bhavitang Shilajit or Gomutta Bhavitang Shilajit. In this condition, Shilajit is giving in the 14 days or 21 days regimen. Means first 3 days we are giving Shilajit Rasayana at 25 mg, 25 gram morning and evening. In our book it is mentioned you have to give in single dose, but our Agni is very much Manda, so we cannot consume so much Shilajit in morning. So it is better to give in two morning and evening at 25 gram each. It is on that we have for first 3 days we are Shilajit Rasayana we are giving with Tifala. Thereafter we are giving with the Jostimudu Kashay. Next 3 days we are giving with the Patal Muladi Kashay, and last 3 days we are giving with the Bornadi Kashay. We can follow the same regimen 7, 14 or 21 days as mentioned in our book. People erosion is generally prefer our in the respiratory tract of infection or in lung carcinoma. We are giving the people erosion. We know the Bardhaman people doses as we know. Gomotra horitaki also we have to give in Bardhaman matra. Generally in the ascites or udar rug cancer, we are preferring the Gomotra horitaki. If we started, we generally increase the dose up to 10 days. Thereafter 10 to 20 days, we have to maintain the doses. After 21 days, we have to just reduce the dose. Saribadda sab and Kumariya sab also is very much familiar with us. It is generally given in BPH with additional Tamravasha or Loknath Rosh or Bangavasha. Next slide. There is a lot of question also is there. Some are given below. That is Boronari Kasha is generally given in the BPH. Gugultikta Kasha also is given in the skin carcinoma. Tuentary Kasha also is giving in the GI tract cancer. Gugul or Kanchana Gugul is very much we know. We are giving it in the any type of cancer. Mahatikta Gito, Karanja Gito, Panchayikta Gito, we are also giving for before sudden treatment. Okay, next slide. There is a lot of herb which can help in carcinoma. A lot of study has been given. Generally, Guruchi, Tagore, Lojjalu, Bivitok, Loshun, Karavi, lot of Koshani Ajwan, Tatura, Nirgandi, Kadambo. There are a lot of herbs is there which is given, which is used for the cancer treatment. Next slide. Generally, the ashwagandha has been enhancing the cellular response. Generally, it stimulates the P53 tumor necrosis factors. Whereas the turmeric, that is curcumin, blocks the NF-kappa B, which uncontrolled and multiplication of the cell has been arrested. Triphala also is very much familiar with us, which helps to prevent the angiogenesis. Bala is the natural source of anti-angiogenesis also. Ashwagandha also blocks the newer blood vessels. Guruchi is arresting the abnormal cellular growth. Okay, next slide. Monjista has a mild anti-neoplastic activity. It mainly acts in the uterine and ovarian carcinoma. Shataburi has anti-carcinogenic effect and it mainly reduces the epidermal carcinoma of the nasopharynx. Nimbo also has the chemoprotective actions and also help in the plastic CA, hepatic CA and extrahepatic site also. It can be very. Next slide. Next slide. Generally, our herbal medicine or our medicine generally helps change the cancer surrounding area, which the cancer cell cannot be multiplicated. So, which the abnormal proliferation, which abnormal proliferation is occurring, it helps to obliterate, arrest the growth. Mainly, the angiogenesis is obstructed by our treatment. There are a lot of study has been done regarding. Next slide. Some are given below. Next slide. And that is, you know that Mahindra is much more familiar. We know the ventilation is used for the chemotherapy. It blocks the tubulin binding M phase, which help in the which arrest our growth of the multiple replication of the cells. It generally arrests the M-phase stage of the carcinic stage. It also helps in against leukemia and nephroblastoma. There is another is known as Almadia. Next slide. Next slide. Next is almond. It is also as known as golden trumpet. You are very much familiar with this disease. This picture. It also help in cancer treatment. The mainly this type of the alkaloid has been extracted and is used in cancer treatment. It also arrests the memphis. It generally help in experimental study in lymphocytic leukemia in the mice. It has been shown in good results. Next slide. It is also one type of bringraj. The main principle is the constituent is the Wellington lutein alpigin, which mainly suppress the prostate cancer. Has been known, has been seen that it arrests the growth of the prostate carcinoma. Mainly it arrests in the signaling pathway. Next slide. We also is known as the ginger lily. It also help in the it's shown good result in the lung carcinoma induced that the principal component is the poronin D. It mainly inhibit the action of the necrophilic factor kava. Next slide. So in a word, we just conclude our talk. The most superficial level we can treat like this. When there is severe cancer pain, we can go for pain due to cancer. We can go for the Rasagandi Mejupak, Somnath Tamramundu, or Chandamol Sinduram. Generally, in the pain condition, we also use the Nagbhasha along with the Bangabhasha to treat these conditions. In anemia, we generally prefer Logabhasha, Mondurvasha, Apragbhasha, Hiragbhasha, Siddha Mokta to treat the disease. Generally, in this condition, we can see the CRP is much more high, whereas the hemoglobin will be low. On this condition, we can go for this type of bhasha preparation, which helps to improve the anemia. Generally, we find very good results within 1 to 2 months. Next slide. To remove the side effect of the chemotherapy, the Rasayan Oshodi is very much effective. Generally, we prefer the Guruchi, Haritaki, Bibitaki, Amlaki, Nimbo, Chirota, Tulsi, Raktarohita, Kumari, Shariba, Manjista. We are preferring this type of medicine. Kumari and Guruchi is much more familiar. We are using very much after chemotherapy treatment. For excessive vomiting, where Dakkari Kasha is generally used. When there is a nodule, we can go for the Shawadevi, Guruchi, Fruit, Horitaki, Lake, or Komutto. Means if there is, we can go for the Viragda state, we can go for the Kifala Gomutto Lake. And if we go for the Ama, we don't go for the Viragda state, we can back to the Ama Avastha, we can go for the Guruchi Lake. It also helps to make it in the same condition. Next slide. Next slide. When there is morphine induced constipation is there, because we know morphine is much more given in the later stage of carcinoma. When there is severe constipation is there, because due to reduce the pain, we are using the modern treatment is using the morphine to diminish the pain condition of the patient. On that condition, we can go for the misflex to reduce that condition of the morphine induced constipation. And there is another in the mucositis is also very much common. On that condition, we can go for the radiation induced mucositis. We can go for the Shotazotophyto, that is the externally. And to prevent the recurrence of the carcinoma, that is much more important, we can go tell the patient to take Tulsi, Dr. Rohitak, Ashatta, Udumbor, Guruchi, Shumanjan, all are Russian type of medicine. Generally, after chemotherapy or if the cancer is removed, we have to tell the patient to take this medicine at a 1 month or 2 month interval regularly. Okay, next slide. Generally, the medicine which is very used for the prevention of cancer are the Kusthar, Arakbat, Gorochana, Bhalata, Roshun, Roctorohitok, Shariba, Monjista, Boru, Nimbo. There are a lot of medicine is there which is very much helpful. Previously, we have discussed Roshan also we can use as a Roshan Kiropak in Bardhaman Matra for cancer stage. All this medicine we can use for maintenance of the and good health of the cancer patient. Next slide. Okay. Thank you. If any question you can ask.
Anybody is having any queries, they may ask the question directly to sir. If anybody is having any question, they may ask the question. Sir, I'm having one question.
Okay.
In case of yes, sir. In case of prostate cancer, if due to the exposure of radiation, whenever the proctitis is occurring, in that cases, what would be the actual treatment?
If proctitis will be there, we go for the herbal preparation. If the radiation have already done, in prostate cancer we can divide in two parts. One is go for the modern therapy, and one patient that were not gone for the modern therapy. If not gone for the modern therapy, we can go for Gomutto Bhavita Shilajit or Google Tikto Shilajit as a Russian matter. This Shilajit we have to go in the much more quantity, that is near about 50 gram in mark. But when after you just tell radiation, we can go for the kashaya, mainly the Tifala kashaya. Means it should be in Shammo in nature, not means we don't prefer the Bonadi kashaya. We have to prefer Dakkadi kashaya, Amlakadi kashaya, and Toyantadi kashaya. In this type of medicine we are giving for after radiation. That is which is Shammo in nature.
Okay, so Banunadi Kasha is not recommended in that cases?
No, Bonadi Kasha has local Lekan property. We can go with the Guguti Shilajit. So if we give on the condition, it's exacerbate the condition.
Okay, sir. Okay, sir. And for application, I mean external application, which oil would be better for that?
Which type of carcinoma?
I mean, in case of prostate cancer, whenever the proctitis is occurring due to the exposure of radiation in some cases, so which kind of better?
Gita is commonly used. Shotodauta Gita is better. Shotodauta Gita is better.
Yes,
very much familiar.
Yes, sir. Thank you so much, sir, for your very informative and very beautiful presentation for our all participants. So, anybody still having any question, they may ask. Otherwise, we are going to stop this program now only because 7 p.m. again we are having another speaker. So, thank you so much, sir. Thank you for coming here. And the 7 p.m. again will be here. And that time, Dr. Sulavna Bosch, she will be presenting the topic, coronavirus effect on Manasik Swastha of an individual. So for some 1 hour, we will take some, break, and afterwards again, we will be coming. Thank you so much. Thank you so much, sir, and all the participants.
Okay.
Namaskar.